dog needs some exercise, so then we put our dog on the treadmill. But we have to take some action. We have to take health into our own hands. So one of the reasons why I started looking at health different is I grew up in Idaho on a farm, played lots of sports, and I was the kid that would go and find nutrition books and just devour them. I'd read them like crazy, and I always thought that it was nutrition that could cause our bodies to heal. Fortunately, my parents were very pro natural medicine. They did the best they could, and I one time was at our basketball game, and I gave the entire basketball team 6 grams of vitamin C. And what happened is we're all out playing basketball, and suddenly we all end up getting diarrhea. So we're all running back and forth. We got it, coach, take me out, and we lost the game. But I've gotten a little better at nutrition. But originally, I wanted to help people because I've always had affinity towards health and enhancing performance and making my brain work better and my body. And what happened is when I was at the University of Utah, I was studying, just on the track to study traditional medicine. And I kept asking the questions. I was like, well, it sounds like there's only 2 things that we can do when it comes to health. And one of those is drugs and the other one's surgery. But what about nutrition? What about herbs? What about, meditation? And one of my professors at the U, Dr. Bauman, what he said is, he's like, Reagan, you should look into a different type of medicine. And so I was like very skeptical. I was like, well, natural medicine, I don't know about that. But I looked into it I tried to have an open mind. I found Chinese medicine, and I found with acupuncture, Chinese medicine, I could not believe the volumes of research. The National Institutes of Health, they just had released this study in 1997, and they said, wow, acupuncture outperformed conventional treatments. And the list of conditions like migraine headaches, tendinitis, back pain, headaches, neck pain, infertility, fibromyalgia, IBS, Crohn's disease, acupuncture outperformed conventional treatments in all these things. So I said, it's worth me looking into. So I actually went and had a treatment with a Chinese doctor, an acupuncture treatment, and just felt phenomenal. And so after about a year of studying with him and finishing some of my work at the U, I decided to do my medical training in Hawaii. And so I actually went to the traditional Chinese medical school of Hawaii on the Big Island. And it was affiliated with the Northern Hawaii Community Hospital, which was founded by Earl Bakken, who is the inventor of the pacemaker. And Earl Bakken, one of his mantras was, you prevent disease 20 to 30 years before it ever shows up. And so one reason why he wanted the holistic approach when it comes to health is because he knew that it could have radical abilities to prevent diseases before they ever come up, because he knew Western medicine very well, and he knew Western medicine is disease specific. So I always tell people, if you're having a heart attack, you're not going to want to come to a guy like me. I wanted to enhance health. I wanted to reverse chronic disease, and that's what we do. So that's a little bit about me. Now, let's talk a little bit more about stress. So I told you I'd explain how stress can impact your hormones. We talked about the receptor sites on your belly, but there's 3 types of stress that we have to look at. There's physical stress, there is chemical stress, and there's emotional stress. Now, in physical stress, that means if you were born, you had some physical trauma. Because anytime if you're born vaginally, you're coming through the birth canal, that puts a lot of pressure on your head. That's why you end up with a cone head when you come out. If you're born cesarean, then you're going to have trauma because you did not get the proper bacterial inoculation at birth. So then your immune system becomes a lot more susceptible to infections, colds, sicknesses, all those things, chronic disease. So physical traumas also have the impact on the nervous system that causes inflammation in your body. So a lot of our patients have had traumatic brain injuries, and what we find is those traumatic brain injuries start to impact your digestion, they impact your mood. I had a patient that came to us, and she's like, I don't have any, I've never had any kind of brain damage, any head trauma, nothing like that. But then once we started asking her questions, because she's had migraines for 20 years, and I just asked her, I said, well, have you ever had, roughhouse with your brothers? Have you ever, did you play any sports? And all of a sudden she starts crying. And she said, you know what? I have not thought about this since I was a teenager, but when I was a teenager, I was on the roof of my garage, and we had a swimming pool at our house, and we used to jump off the roof of our garage into the swimming pool, and we did that all the time. And she said, as a matter of fact, one day I was on the roof of my garage, and I was getting ready to jump off, and my brother walked on that little cement pathway in between the garage and the pool, and I hesitated, but I still was going too far forward, and she landed right on her head. Now, I asked her, I said, Sharon, well, you've had headaches since you're about 15. Now, when did this accident occur? And Sharon told me, she starts crying. She's like, I can't believe this. That's right when the accident occurred, is right around the age of 15. And so anyway, we were able to get rid of that inflammation, calm her brain down, and she's made amazing strides. So we have to look at the physical trauma in your body. Those are key. Okay, so the next one we're going to talk about when it comes to stress is chemical toxicity. Now, if you look at chemical toxicity, we're exposed to over 80,000 chemicals every week, according to the EPA. Now, those chemicals, they have the ability to disrupt our endocrine system. What that means, that's a fancy term for just saying they affect our hormones in an adverse way. So when the EPA is looking at chemicals, they'll say, this chemical is safe, this one's not, this is carcinogenic, this one's an endocrine disruptor. But most of the 82,000 chemicals, that can be chemicals from the food that we're eating, from the air that we're breathing. If you're a lady, from the lipstick you put on, there's lead in the lipstick, so you're going to end up with 14 pounds of lead by the end of your life. It's from the eyeshadow for you men. No, I'm joking. It's from all those medications that we take. All those chemical traumas, they build up in our bodies, and then we finally will reach a threshold where our bodies become toxic. And then when your liver's not working properly, that will affect your metabolism. If your kidneys aren't filtering the electrolytes properly, you won't feel hydrated. And your cells, you won't have the right amount of energy in your body. So we have to, first of all, we have to look at the chemical stressors out there. Now, are there some things you can do to get rid of those chemicals? In most cases there are, but we live in an environment and in a planet that's sicker than it's ever been. I mean, if you look at it, yeah, we're trying very hard to clean up the environment, but we're not succeeding yet. I'm not hopeful. I'm an optimist at heart, but that is the health of our planet is reflective of the health of us as humans. The third type of stress that we're going to talk about is emotional stress. So, do you have any relationships? Hopefully you do. If you're human, you've got to have relationships. Otherwise, you're not going to have much of a life. But those relationships can cause emotional stress. What else is causing stress for you? Maybe it's your boss. Maybe it's your kids. Maybe there's financial stress. Maybe your car broke down. Maybe you got injured. We know that health has a big impact when it comes to emotional stress. So those three types of stress are the biggest ones that we found that start driving down the function of your body, because in order for you to manifest any symptoms at all, your body has to lose about 70 to 80% of its function. So we think, oh, it's a headache, it's normal, everybody gets headaches. Well, it's common, but it's not normal. A headache is one of those that's like the check engine light that comes on your car letting you know something's wrong. So when you're looking at those stressors, think about the symptoms. Anytime a symptom shows up in your body, it's already too late. So you got to act fast. So one of the best ways to decrease stress in your body is to get healthy food. Now, a lot of us, we reach for food when we feel stressed or when we feel overwhelmed. So I want you to break that habit. Next time you're going to reach for food, I want you to drink a glass of water, and I want you to breathe, focus, just get your breath moving, move your body, stretch out, do some yoga, do some qigong. But we have to have a better relationship with food, because food is meant to repair our bodies and regrow our tissues. Look, everything you're eating is either preventing disease or causing disease. And unfortunately, in our healthcare system today, we're not looking at prevention. All we're looking at is, what disease do you have? Because if you think about it, you go to your doctor, what your doctor is trying to do is establish a diagnosis for you. So if the first thought in medicine is, well, what condition do you have? And then once you have a name for a diagnosis, once you've been put in a box, then it's, what drug do you need to take care of this medical condition? Now, I don't know about you, but I don't like being put in a box. I also don't like being on a medication for the rest of my life. Of course, if I've got a raging infection, I'm going to take an antibiotic if nothing else works. But in our country, the pharmaceutical industry has taught us to think that once we have a disease, then there's a specific drug to treat that disease, and we've been marketed this for decades, and that's one of the reasons why pharmaceutical companies make billions of dollars every year. In fact, the pharmaceutical company is so prolific in our society that the average person in our country is on 2 medications. So that's pretty crazy if you consider all the people in America. And when you're on those medications, how long is it for? I mean, you're on them for a couple months and you're off them. Besides an antibiotic, you're usually on them for life. Because a lot of us, what we do is we ignore symptoms. We let things get too run down before we try to take care of our health. Or we rely on somebody else. We rely on a medication. We wait for that magical study to come out. We watch Dr. Oz and we're like, okay, Dr. Oz has got the magic bullet for us. But really what we have to do first of all is we have to watch out for symptoms like bowel difficulty. Because what we found is your digestive system has such an impact on your overall health. And if you ignore bowel difficulty, that's when you can get diseases like IBS, which over 35 million people in America have IBS. It's actually more common to have IBS than it is to have diabetes. But nobody's talking about it. Nobody's doing much, because with diabetes, there's a whole drug industry around it. You follow the American Diabetic Association's guidelines, and if you eat the food they tell you to eat, your blood sugar goes up. You take the drug, it pops it down. Gets too low, you got to eat the food, and then your blood sugar goes up. You take the drug, it pops it down. But with IBS, there's not some simple fix with a medication, so you don't see a lot of commercials for it. There are some drugs, but IBS can be reversed. We reverse it all the time. The other symptom that we ignore is tiredness. So would you like more energy? Would you like to feel less sluggish? Do you wake up in the morning just kind of dragging? Do you have that 2 o'clock slump where you've got to lay down and take a nap, or you've got to guzzle some coffee, or smoke a cigarette to get your brain working again? Because a lot of us, we need more energy. Now, the health and vitality of your body creates energy, so you have to generate energy. There's nothing outside of yourself besides what you put into your body that will give you energy, but it's how your body digests and absorbs that energy that give you energy. Depression. So many of my patients come in with depression. I had a patient the other day, and it was really sad to see, but my patient had been hurting herself. I could see the cut marks. She was so depressed. She'd been putting on weight. She was on 5 different medications, and it was really sad to see the level of despair that she was at. She realized, like, wow, these medications, they aren't working, and now I'm starting to wonder if it's the medication that's making me feel more crazy than the depression did in the first place. And so I know that you may struggle with depression, you may struggle with anxiety, and a pill is not necessarily the answer when it comes to your depression. You got to figure out why. And with the research that we've seen, there's a lot of things that relate right to your digestive system. Your brain and your digestive system. You fix the systems in your body, you look at the cause of depression rather than focusing on the depression itself, and a lot of times the depression goes away. But you got to get yourself healthy because it's not your fault. It's our society that treats depression with a drug instead of looking at the cause, instead of talking to a person, helping you work through the issues, finding out what your physiology is doing, and then fixing your psychology and your brain.